our next session. Our next speaker is Dr. Lenny Da Costa. He's one of the leading practitioners when it comes to understanding about heavy metals, chelation, geriatric health. His work in the area of heavy metals and chelation is highly commendable. He is a consultant geriatrician, preventive cardiologist, and anti-aging and a functional medicine specialist. And he has more than 20 years of experience in working with chronic disorders. He's the president of Society for Regenerative Aesthetic and Anti-Aging Medicine India. He's also the president of the Indian Society for the Study of Metal Toxicology and Chelation Therapy. He's a faculty at Functional and Metabolic Academy India. And the list is long, so I'll stop here. We'll have him today speak about heavy metals and why chelation is important and how it can help immensely in addressing gut issues. Over to you, sir.
Okay, can everyone see my screen and
yes,
hear me?
Yes, yes.
My guys, my voice is a little not on the best side, so excuse my voice. But I have some nice matter for you this morning. But first, thank you to the entire IAFM team, Ruhi, and everyone else for the patience and understanding and having me here. And I hope you guys have had a feast of information over the last 2 days and this morning. An excellent lecture that I just heard on gut health and gluten and everything else. And I think this is going to be a continuation from there. So let me get started without further ado. I've been asked to speak on heavy metals, chelation, and gut health. And so what are these heavy metals? These are metallic elements which have high atomic weight and density 5 times that of water. Now, there are more than 20 of them, but there are 4 or 5 of them which are of particular interest to us, because there's a lot of work that has been done to show how these affect our diseases and the diseases that we suffer from, especially the chronic degenerative disorders. And those are lead, cadmium, mercury, and arsenic. Now, these 4 heavy metals are highly toxic. And what we need to understand is you don't need to get poisoned by these. You need very, very small concentrations, very small, minuscule amounts to keep entering your body on a daily basis. And then over a period of time, they do cause serious problems, right? So let's look at how metals affect us, why they do. And I'm not going to get too much into this because these are subjects that take a long time to delve in. We have a full day workshop live or 3-day workshop on these to understand the mechanisms, but I'll try and touch upon the main ones. And what do we do about them? And this is going to be what I'm going to be talking about and how it affects the gut and various other organs. And we'll see all that and then understand what we need to do about them. So it's going to be a comprehensive thing so that you understand why, how, and what we do. So why are heavy metals so bad for us? And how do they affect us? My dear friends, the air that we breathe is full of toxic metals. And this is surprising because people will ask us how. Let me give you only 2 examples. There's a lot of work that has gone to show that in countries where there's a lot of pollution, there's a lot of lead in the air. Now, that lead could have come from our petroleum products, which had lead in it earlier. Now have unleaded petrol, but some of them still do have. The other thing that most of us don't realize is when we were kids, we used to get a lot of tires, rubber tires. They were not radial tires. Today, radial tires. The process of radialization, they use cadmium. Cadmium dust gets into the air. Small amounts of it gets into your body every day. The food is full of metal-related toxins. Where do they come from? They come from everything from fertilizers to pesticides. And of course, all of this gets into the groundwater as well. So the groundwater is full of metals. And it is this which is the root cause of chronic diseases like ischemic heart disease, diabetes, stroke, hypertension, peripheral vascular disease, and autoimmune conditions. Now, how do they actually affect you? We do have what are known as functional.
Can the others hear Dr. Lenny?
No.
Okay, I think we just lost him. So he'll join back soon. I request everyone to just wait for a minute while he joins back in. Please post your questions in the Q&A while he joins back. Heavy metals is a very important topic when it comes to chronic health issues, be it autoimmunity, autism, even diabetes, hormonal issues. And there are various, and it has to be done very carefully. And Dr. Lenny is one of the experts who specializes in the process. So while he joins back in, if you have questions, please feel free to post it in the Q&A section. So,
Guys, sorry about that. There was an outage.
No problem, sir.
And everything went down despite all. Let me share. Just give me a minute, guys. All right. So why do these heavy metals affect us? Now, we have in our bodies something known as functional metalloproteins. These are proteins that have receptors for them for molecules like zinc, magnesium, and all the others that, that form cofactors for various biochemical reactions. Now, when you have a heavy metal like cadmium that comes in, it goes and sits on the same receptor as zinc, knocking the zinc out. What does that do? That makes this functional metalloprotein an inactive metalloprotein. And what does that have? What does that do? It stops the biochemical reaction. When that happens, your cells malfunction. When your cells malfunction, your organs and systems start malfunctioning. But what do we do as doctors? And what have we been doing as doctors for so many years? We look at the outcome of that malfunction and try to sort that outcome, that symptom, not realizing that if you had to take care of the root cause and remove that heavy metal from there, you would have stopped the entire disease process itself. And so we have been ignoring a lot of the medical literature. Now, I have put in about 2 or 3 slides to tell you, because this is what I've been doing for the last close to 20 years, using chelation, using removal of heavy metals to treat patients with things like ischemic heart disease, and cerebrovascular disease. And I've done more than 25,000 patients. But when people used to ask us, do you have scientific data to back this up? Here is the scientific data. There are lots and lots of studies to show you that heavy metals do cause atherosclerotic cardiovascular disease. They do cause a whole lot of problems in your coronaries. They affect even the kids' hearts. And there is more. Every one of the metals have been shown to cause things like hypertension, circulatory problems, have higher incidence of cardiac bypass surgeries. Even arsenic, please understand, arsenic comes from rice. Many of us are rice eaters. And many of our areas, especially in the eastern part of our country, is high in arsenic. We think that mercury doesn't affect us. Mercury does. Mercury does affect us. There are studies that show that people who are exposed to mercury have a higher risk of MI and death. And as you age, the chances are double for a myocardial infarction. So there is enough and more medical literature. But what do? We conveniently ignore it. Why? Because it's simple. It's very simple to go and look at what are the guidelines, follow it. We've done the job. Whether the patient has benefited from our treatment or not, we have not bothered. Fortunately, that is the fact. That is the reason why we have an epidemic of cardiac diseases that is going on around. Again, more data here. Many people turn around and say that mercury comes from fish. What we ignore is mercury is in our mouth at many a times because it's in our amalgams, and we don't bother to look at those many a times. Now, after having given you a little bit of a brief on what happens with our cardiac systems, and that is what I did learn and I know, and I can go on for the whole day and giving you reasons and mechanisms of how it does, I like to tell you why it all starts in the gut. And it's not coming from me. It is evidence that has been coming year after year after year. And I think the evidence that I've collected for this session is over the last 3 or 4 years. And so here we go. Arsenic and cadmium exposure cause significant changes to the gut microbiome and metabolome by affecting bile acids, amino acids, taxa associated with the metabolic health. The earlier speaker spoke to you about your entire microbiome being an entire new organ. And you have something that gets into your diet that goes and makes this organ malfunction. And we'll see the results of that. I'm not going to state, literature tells you that. Toxic effects of various heavy metals, either in single or in multi-metallic combination, and the gut microbiota associated host health and disease condition need a comprehensive assessment with important considerations for therapeutic and protective strategies against the damage to the gut microbiota. This is as recent as this year, right? Then we'll look at the entire gut microbiome has been regarded as a vital metabolic regulatory system in the human body. This was in 2015. The gut microbiome is an eximious candidate for heavy metal-induced toxicity, as these organisms cause alterations in the gut microbiome composition, which may be a vibrant mediator for heavy metal bioavailability and harmfulness. This is as recently as 2019. My dear friends, what is this telling us? It's telling us that the food that we eat, which is laced with a lot of this stuff, is directly affecting, you're actually poisoning your microbiome. And what happens? The disturbance of the gut microbiome by heavy metal accumulation affects various metabolic functions. And this results in the disease development, various diseases. And we'll see that too. We all know that the gut microbiome helps in gastrointestinal production, digestion, and the secondary metabolites produced there are required for the intestine, but even for the brain. We know about the gut-brain connection. And I'm sure there is a speaker who has spoken about that in the last 2 days. And so any event which disrupts the gut microbiome affects functions and may end up with disease conditions. And let's see if there's evidence to that. Here we go. Inflammatory bowel disease, 2017, a lovely paper. Cancers in 2019. Atherosclerosis, I can give you any number of papers on that, but this is one of the most recent that I picked up. Obesity, the earlier speaker spoke so beautifully about it. Liver disease, Wang et al. In 2021, that's last year. It causes even liver diseases, kidney diseases, of course, cardiac diseases. I can give you any number again. Autism. We all know there was a beautiful panel discussion yesterday on autism, I guess, or the day before, I'm not sure. But yes, heavy metals directly related to autism. You remove the heavy metals, you see your patients doing extremely well. I've been doing tons and tons of kids over the recent 3-4 years, and they're doing very well when we try to remove the heavy metals. How many of you know epilepsy has its origin in the food that we eat because of the heavy metals that affect us? There is a recent paper on that as well. Atopic dermatitis, the earlier speaker spoke about it briefly. Yes, there is data, but all of these, there is a cause. We treat the effect. We don't remove the cause. And I put this down specifically for you to show you how heavy metals, when they enter our gut, affect us, cause any number of these diseases. And so what happens? You get heavy metals, it affects the normal gut microbiome, it disrupts the barrier, it alters the metabolism, causes neurological disorders. Many of those detrimental metabolites cause cancer. They cause cardiovascular problems, diabetes, obesity, allergy. Where do these heavy metals come in? They come in your gut. And what do? We give them probiotics. Why? Because probiotics protect intestinal barriers. They enhance absorption, sequestration, chemically modify heavy metals, and facilitate excretion. Yes, they do. Initially. But if you keep loading your system day in and day out, then at some point the probiotics stop working. And that is when our problem starts. That is when our diseases set in. That is the reason why as you grow older, your degenerative disorders start progressing fast. At times they gallop. None of your medications work. None of the supplements work. None of the food diets work. Why? Because you have destroyed the cause of destruction of your microbiome is still in there. You have not removed the heavy metals. You have not even looked at removing the heavy metals. And why? Because when this starts, it starts because of vague symptoms. All right? Things like chronic fatigue. We say too much of stress. This is where you know your system is getting affected. Depression. There are tons and tons of studies to show you heavy metals. One of the first signs is depression. And we do nothing about it. We give them antidepressants. Anxiety, insomnia, digestive problems. Obviously, if your gut is affected, you're going to have bloating. You're going to have change in your bowel habits. You're going to have indigestion. What do? PPIs, antacids. And then if we don't do anything else, we say, okay, let's treat the gut. But treating the gut is great if you're also treating the cause of the gut inflammation and the gut problems. Hormonal issues. I do a lot of bioidentical hormone replacement for women, both perimenopause, premenopause, and postmenopause. But let me tell you something. I will never start without detoxifying any of my patients properly, because you never know what the heavy metals are doing. And each patient is different. One size doesn't fit all. For all my autoimmune patients, I always detoxify them. Because one of the major and the earliest things that happen to many of these patients, if they are not already having heart disease, is autoimmune conditions. Now, most of the symptoms are very vague, but they later on result in a whole lot of health conditions. And we try to treat those health conditions, but we are never free from them. And that is when you need to look and see, can we go to the root cause? And the root cause is your heavy metals. So, my dear friends, when you look at this whole conundrum of heavy metals, it starts for adults as silent symptoms of chronic, low-level heavy metal accumulation in tissues, and it can progress from a steady decline in energy, productivity, and quality of life to some very serious disorders like cardiovascular disease, premature dementia, and total debilitation. Unfortunately, none of us consider the possibility of heavy metal burden, and patients generally suffer needlessly. And so if you really want to go to the root cause, what is the root cause? It is the heavy metals. So what do you need to do? You need to do a real detox. And the real detox is cellular detox. If you want to get well, if you want to get normal, if you want the disease to go away, you have to fix the cell. And today we are realizing that most cells are losing their innate ability to detoxify themselves. And my dear friends, my purpose today is to tell you that we need to fix this. When we do that, the genome can change. When we do that, the cells do what they're meant to do, keep us healthy. So how do we go about it? Remove the source, regenerate the cell membrane, restore the cellular energy, reduce inflammation, reestablish methylation. All of this happens when you start removing heavy metals. So to do a complete cellular detox, you need to open up the downstream pathways and keep them open. The one important thing that I am going to stress today is you need to use true binders or true chelators. These are vehicles that make sure that toxins from the cells that are removed out by various other antioxidants that we use are on their way out of the body into the toilet, so to speak. They're thrown out completely. They don't redistribute themselves. When you don't use a true binder, what happens? Heavy metals are removed from one tissue, dumped elsewhere. They're reabsorbed in the gut and they are again redistributed. This is very, very, very important in those people who are suffering from leaky gut and who have a very bad diet history of having gluten and other things that do cause the leaky gut. So when we look at chlorella or cilantro, and why am I talking about this? Because we come across a lot of people who come to us and tell us, Doc, we did this 10-day detox and it's great and feeling good. Yes, you may be feeling good, and I'm not sure whether it's a placebo effect. But both of these are weak binders. You may have to do it daily to try and get rid of some of the stuff that can get in, because these weak binders help when you're being exposed to it. So on a daily basis, if you're taking it, you can get rid of some of the daily intake of heavy metals that you're exposed to these days. But if you're doing a 10 days detox, they are weak binders. They don't remove it out of the body. They do redistribute it. Hence, the chances of those heavy metals crossing your blood-brain barrier are very, very high. Then there's the issue of auto-intoxication. Now let's understand this a little bit. Bile is meant to digest fat. So when you eat something fatty, bile gets dumped into the intestines. Are we getting this? Bile is meant to digest fat. So when you eat fat, obviously you have some amount of bile that is dumped into the intestines. But this is meant to be reabsorbed so that the liver doesn't have to completely keep creating it again and again and again. Many of these toxins that come into the intestine get stuck on to the bile complex. They're dumped into the gut to digest fat, and they're reabsorbed, causing auto-intoxication. And so you need to be careful when you give this 10-day detox treatments, especially when you have serious patients. It's great for somebody who's perfectly okay, just feeling a little off. It's a nice thing for a weekend retreat. You give them a 10-day detox and you send them away. But if the patient is serious, you may sometimes be causing more harm than good. Always remember, detox is a long-term treatment, cannot be done in short spans of time. This is not a quick fix. We have been exposed to the offending chemicals for a lifetime practically when patients come to us. That is what you need to explain to the patient. If the patient is 40 years, 50 years, 60 years, that is the length of span that they're exposed to it. They need to give us at least 60 days, if not 6 weeks, to take care of them, or 6 months to take care of them. It's a long process. It's a slow process. Heavy metals are not in your blood. They're sitting in your tissues. You need them. There is a process. You need to pull them out of your tissues. And from there, you need to bind them and take them out of your body. And so good detox takes some time. We have amalgams that are a source of problems because they have mercury in them. Vaccines are a big source of mercury and aluminum. A lot of them bioaccumulate in our brain, thyroid, and even in the adrenals. But they all get absorbed from our gut, most of them. You have subclinical thyroid imbalances. You have cortisol imbalances. These are what we see as symptoms, and we try to correct them. But the source is the key. You need to go to the source and turn the key off. So if you have amalgams, remove them, my dear friends. If you've had vaccines, do a proper detox. So no diet, no proper food, no supplements help if the source is going to keep affecting you. The key is to remove the source, remove the heavy metals. That is when your body starts healing. That is when your immune system reestablishes. That's when your gut reestablishes and heals. And that's when you get your health coming back to normal. So the key is to know the source and remove it, my dear friends. And what are your detox options? I use these. I use IV chelation, which is with EDTA, glutathione, vitamin C, and ALA. And I'm going to speak very briefly about each of them today. And for those of you who can't get to IV chelation, I use something called FIR saunas as well. And I'll explain that to you a little bit as well. And then we have oral chelators that we do use as well, DMSA and alpha lipoic acid. So let's look at them in a little bit. So first, let us understand the whole process of chelation. There is something known as mobilization. What is mobilization? Mobilization is stirring up the heavy metal, in this case, mercury, let's say, from the tissues, from where it is sitting. You need to pull it out from there. Mobilization may lead to excretion, but it can also lead to redistribution. So detoxifying or detoxing means you need to mobilize, and after mobilizing it, move it out of the body. There are no true detoxifying agents in our food supplements or in many of the vitamins and minerals that we take, which we claim are chelators or detoxifying agents. All of them are mainly mobilizing agents. Chlorella, cilantro, these are mobilizing agents. Glutathione is a mobilizing agent, and I'll explain that to you a little bit. But ALA, alpha lipoic acid, it has 2 sulfur atoms. It's a diethol. And this is normally used by the body in small parts as part of enzymes for producing cellular energy. But because of these 2 sulfurs, what ALA does is it can bind to mercury and many other heavy metals. Why am I saying mercury? Because a lot of the heavy mercury is sitting in your brain and in your nervous tissues. And ALA is one of the molecules that goes to both of these, and we'll talk about it a little bit. This is one of those binders that can take it out of the body. Healthy body also uses glutathione. We have glutathione stores in our body. What does glutathione do? It also detoxifies your body. What does it do? As the heavy metals come in, it pushes it out of the cells, but it can't take it away from the body. It can only use it to remove it out. It removes mercury and other poisons. You need something else to throw it out. If your body is functioning normally, because of the good amount of metallothioneins present there, so there is another concept of metallothioneins. Metallothioneins are our body's natural chelators, which kind of take all of this that glutathione throws out and pushes it out of the body. But as the overload gets more and more, these metallothioneins don't work. One of those reasons being zinc doesn't work as well because it gets displaced from many of its receptors. And you need zinc to function properly with metallothioneins. And that is when heavy metal toxicity, chronic heavy metal toxicity, starts setting in. N-acetylcysteine is something that many people talk about. Yes, it's great to remove mercury from within the cells. It's also a precursor to glutathione. But it does only part of the work. True chelators penetrate into body tissues and actually pull the mercury out, pull the other heavy metals out, and throw it out of the body. There are various other non-chelators, and I'm stressing on this because people are not understanding and they say chelation doesn't work. There are non-chelators, which some refer to as chelators. These help when the body is, when the heavy metal like mercury is entering into the body. I spoke to you about cilantro and chlorella. Or when you just want to pull it out of those cells and put it into the blood. But they redistribute this, like I said earlier. So if you are using glutathione for detoxification, always use it with a traditional synthetic chelator, like a DMSA oral. GMPS we don't use much in this country. So if accumulation of heavy metals and hundreds, if not thousands of other foreign chemicals are infiltrating our systems, my dear friends, it is only logical that you need to remove their insulting influences. It is a medical necessity today if you really want to see your patients do well. If a treatment itself causes more damage or leads to long-term worsening of problems, you need to be aware of it. You need to be fully informed about it. You need to take steps to mitigate the risk before you embark on that treatment and you embark on treating your patients with that treatment. This is certainly the case with amalgam removal. We know that amalgams are bad for us and we tell patients, go and remove the amalgam. Not realizing that while removing the amalgam, you can have a lot of redistribution of the mercury. The other thing you need to understand is when we are giving chelation to the elderly, a lot of their downstream pathways, like I said, their liver, their kidneys are not really functioning well. And so you need to not aggressively do it. You need to have patience. You need to explain to the patient to have patience. Sometimes we give oral and transdermal applications as well. But they are slow and they take much, much longer. I've used EDTA suppositories in elderly patients. Low dose, but over a long period of time. And we have reversed conditions like even Parkinson's. My dear friends, it's possible when you understand what the root cause of the problem is. Every chronic degenerative disorder today has its root cause in heavy metals and other toxins. Our bodies were not meant to take these toxins. These toxins are coming to us because of the lifestyles that we lead. We were meant to live a good life, but we have turned our life into hell. We are responsible. This is the price that we pay for the progress that we have achieved. So, my dear friends, these metals are removed by a process of chelation. And my chelating agents, like I said, are EDTA, DMSA, ALA, vitamin C. And surprise, surprise, I also use glutathione and NAC, and I'll tell you why. So, what is EDTA chelation? It's a process of removal of toxic heavy metals from the body, and we use a full protocol of IV chelating agent, disodium EDTA for this. Now, EDTA, in my experience and in experience of thousands of doctors, or millions of doctors doing it across the globe, it has been found to be beneficial in occlusive vascular disease caused by atherosclerosis and chronic degenerative diseases as well, like diabetes. One of my first cases, reverse diabetes, and I was shocked. I was shocked from 40 units of insulin twice a day to 6 units of insulin once a day, and she was doing it more as a placebo for her. I could have removed it off and she was not taking any other medication. EDTA chelates lead, cadmium, and other heavy metals. But please remember, if you're looking for mercury, if you're looking for autistic kids, don't use EDTA chelation. DMSA, this is an oral chelator. It chelates both mercury and cadmium, and I use it for autism and I use it for smokers. We have a smokers detox and we use it for autistic kids. Please remember, autism, we use it over a period of time. It is not a quick fix. Some kids respond in 6 months, some kids respond in 3 years. But the outcomes in each of those cases is great. This is one chelator that you can use very effectively in wellness protocols. While I've not put in the side effects and the safety slides here, let me tell you, DMSA is one of the safest. And overdose, 170 times of the normal dose, was accidentally given to a toddler of 2 years old. And nothing happened. This has been published in a pediatric literature, so well-renowned pediatric literature. So don't worry about side effects of DMSA. Alpha-lipoic acid is potent. Spoke to you about it just now. It's potent antioxidant. It's more potent than vitamin C and vitamin E. But one of the most important things, it is a true binder. It chelates heavy metals. Unfortunately, we don't have the IV version. Whenever I can import it, I import it and use it. But it's an excellent, very good chelator as well. Specifically, if you're doing glutathione for the nervous system to remove mercury, which is sitting there, you need a binder to take it out. IV ALA, even oral ALA will help you. Oral ALA is much slower. You need large doses like 1,200 milligrams a day. But IV ALA of 1,200 milligrams a day is like a supersonic jet together with glutathione or NAC. Like I said, it goes through fat as well as water. So it chelates the entire body. And because it's an oral and it has an oral option, I put it in all my wellness protocols. Anyone who comes to me and says, what is it that I need to do for protecting myself? Oral ALA is one of the antioxidants that I prescribe, and I prescribe a minimum of 600 milligrams a day. And if you are not taking that, you are exposing yourself to a lot of crap. Oral ALA itself will remove a lot of the crap from your body that is getting exposed. And that gives you everything from chronic fatigue to chronic degenerative disorders. There are other things that ALA does, and that's another reason why I want every one of you to have it, and any of your patients to have it. It helps protect the mitochondria, and it recharges vitamin C, like I just told you. But in recharging them, it makes them more effective. It improves insulin sensitivity, and so every diabetic should be having it. It prevents the production of ages. And what are the complications of diabetes? Diabetes complications are caused by ages, right? It keeps your liver healthy. In India, you have it. One of the indications is for liver dysfunction as well. Cataracts, it works for cataracts. My cataract, which was developed 5 years ago, disappeared with 600 milligrams of ALA. And I keep sharing that story, but today I don't have the time to do that. All right? It helps your body withstand the oxidative onslaught of heavy metals. So why not use it? Vitamin C is another major water-soluble antioxidant. It increases extracellular collagen production and important for proper immune cell functioning. I do a full-day session on vitamin C. It plays great roles in L-carnitine synthesis, cholesterol metabolism, cytochrome P450 activity. This is one of the channels through which a lot of the metabolites of drugs and heavy metals and everything go out. And it is very important for neurotransmitter synthesis. But all minerals can have their excretion increased by vitamin C, especially ascorbate. Hence, it's a great chelator, a great detoxifying agent. And it chelates lead, mercury, arsenic, cadmium, nickel, beryllium, calcium, copper, magnesium, and zinc. And when you use vitamin C and you know you're doing a detox, especially higher doses of vitamin C, you need to put in a lot of zinc and magnesium. And this is true for EDTA as well. And so when we used to remove heavy metals, we buffer ascorbate with potassium, calcium, magnesium, and we always supplement zinc orally. Now let's come to these two. N-acetylcysteine. This is a thiol. It's a powerful antioxidant. It's an antitoxin. That's an immune support substance and a chelator of mercury. It helps in the phase 2 because it's a sulfur donor. It's phase 2 detoxification. It plays a huge role in the sulfation cycle. It is a methyl donor, my dear friends, for the conversion of homocysteine back to methionine, which is a precursor to glutathione. I don't want to stress on how important it is to ensure that your homocysteine is low and glutathione is high. That's for another day, but please remember, if your homocysteine is high, your glutathione is going to be low. So your detox capacity in the body is anyway low. So you're accumulating far more heavy metals by absorption through the gut than you would have normally done. Glutathione is a major antioxidant produced. It neutralizes damaging free radicals and peroxide molecules. It's present in high levels in the liver, kidney, and the lungs. 3 important organs that are kind of downstream, that throw a lot of the toxins out. But you also remember, glutathione is important in the immune system. It is required in the lymphocyte multiplication, thus helping in developing a very, very, very strong immune system. So my dear friends, chelation does that biochemical detoxification. Chelation does that removal of heavy metals from your gut, from your body. The gut brings it in because of the food that you eat. Even what you're breathing in at the end of the day is sitting in your tissues. When chelation is used, it does the biochemical detoxification. It stops the mechanisms that cause disease formation, that cause chronic degenerative disorders. This is what happens. This is the benefit of chelation if you're going to use it. Now let me briefly speak to you about, Renuka, how much time do I have?
You have 2 minutes, 2 more minutes to go.
But I started late. Can you give me 5 more minutes?
Sure.
Thank you. So body would recycle any toxin that is not capable of purging, that I've just explained to you. And so when you're looking at chelation or removing or detoxifying your body, you look at all the 7 channels of elimination. And which are these? Lungs, liver, kidney, skin, colon, lymphatic system, and the blood. If one or more of these channels are not working properly, and if you ignore one of these essential systems, the patient will suffer and you will not get the desired results. So please remember that the body is constantly trying to eliminate neurotoxins through its available exit routes. However, because of the lipophilic and neurotropic nature of neurotoxins, most of them are reabsorbed by the abundant nerve endings of enteric nervous system in the intestinal wall. And this is what I want to impress upon you again. 10-day detoxes, be careful. You can create long-term damage. Skin is a very important organ of detoxification and elimination. I can go through a lot of these reports, but there is a lot of evidence that when people were put into saunas, steam saunas, a lot of the toxic metals were thrown out. But steam saunas don't do as well. Many of them had to be supplemented with zinc and selenium, and we need to do it either way when we are detoxing. But understand this, sweat from conventional steam saunas is 95 to 97% water with salt making up the rest of it. But our skin also contains sweat glands and oil glands, both of which help remove a lot of the toxins from the skin. So sweat gets rid of water-soluble toxins and even helps eliminate toxic heavy metals such as mercury and cadmium. There are many studies that have been shown to do that. Oil glands help to remove oil-soluble toxins like gasoline, solvent, pesticides, and ingredients in toothpaste and personal care products, which the body is not able to dispose of unless heavy sweat is provoked. Now, for this to happen, your heat has to be greater than 45 degrees centigrade, which doesn't happen in conventional saunas, because if you cross 40 degrees, your skin will burn. So you need something known as the far infrared sauna. This has been used earlier in various places. This helps specifically when you have bad gut and bad kidneys. The kidneys and the large intestines are already overloaded with toxicity that has greatly reduced their capacity to throw these toxic substances out. This especially happens when you're crossing 50. Why am I talking about this more? Because I am a geriatric physician. I treat a lot of elderly patients, and we need to get them in good health. Otherwise, they're going to keep running and getting worse and worse and worse. So what does far infrared sauna do? It gives you something known as radiant heat. Because of the far infrared emitter, your heat goes within, and there is ambient heating from within. You can raise it up to 55 degrees. We even do it 60 for weight loss. A lot of the fat starts melting. A lot of your toxins are sitting in your fat cells. It speeds up the metabolic processes, because half an hour, which is the maximum, in a far infrared sauna is like having a good fast walk or a brisk walk for 14 kilometers. It inhibits the development of pleomorphic microforms, creates a fever reaction slightly, and neutralizes a lot of the bacteria, molds, yeast, and fungi. It increases the number of leukocytes in your blood. It places demand on your heart. So it's like a workout. It also drops your diastolic blood pressure slightly. It stimulates dilation of peripheral blood vessels. And it relieves pain. Speeds up the healing of strains, sprains, bursitis, arthritis, and most importantly, peripheral vascular disease symptoms, which many of your elderly patients have. But every patient who goes through far infrared saunas will tell you it promotes relaxation, thereby creating a feeling of well-being. They tell you they feel great. So my dear friends, far infrared saunas are capable of covering a broad range of chemicals than any single chelating agent. And therefore, I always use it for my patients who can afford it. I tell them invest in one, because you will not be coming back to me to take IV chelation all the time. You are living in a world which has got so much that you are exposed to, and you're going to keep getting exposed to it, and you need to keep detoxifying yourself, and you need to keep your downstream healthy, that is your kidneys, liver healthy, your gut healthy, so that it can do its normal process. So a lot of the overload goes out from a far infrared sauna. If your doctors who have not invested in it, you should, if you want to detoxify your patients. I don't sell it, so I'm not selling you anything. I'm just selling you a concept that will help you do great for your patients. Chelation is focused almost exclusively on heavy metals, while sweat detoxification pulls out the other toxins and relieves the load on the kidneys, liver, and your gut of all foreign materials that are needed to be eliminated from the body. So please, please remember this. You need to go for a multimodular or multimodal approach when you're detoxifying your patients properly. When you have a toxic situation, remember, your livers and kidneys are the first to get negatively impacted. So first, always check their functioning. If their functioning is not good, don't detoxify IV or even using oral chelators. You need to get their functioning up a little, support them first, and then start chelating that patient. And due to modern diets, my dear friends, like I just told you, you have a toxic cesspool in that colon. This diminishes the capacity to eliminate the toxic loads, even when you're using good oral chelators. So you need to be careful. Always open up the detox channels first. Make sure your kidneys are functioning properly. Make sure your colon is cleansed. Make sure you're having things that you can do for where the microbiome works. So I've not spoken about glyphosate here. Glyphosate affects your microbiome as well. Far infrared saunas help you detoxify your microbiome from glyphosate. We need to pull these heavy metals without dumping them into the body, where they do extensive damage on the way out, or worse, they just get redistributed, my dear friends, to other organ systems. And it is done, it's made worse rather, because of the slow moving flow through a congested colon. So opening up your kidneys, liver is very, very important. You need to support them, but you need to take some of the overload off by opening up your skin channels as well. My dear friends, at the end of it, I know we are all looking at a quick fix. In detox, there are no quick fixes. We need to look at skin as an alternate route of excretion of toxins, lessen the burden on kidney, liver, and colon, leave it exclusively for 1 year or once in 2 years, chelation that you may need to do to remove heavy metals. So explore the possibility of far infrared saunas as well as a complementary therapy when you're using IV or oral chelation. I use them in my clinics and encourage my patients to invest in them, because investing in them now will cut down a long-term expense, which is going to be 10 times probably what their investment will be today. And so we use them when IV oral chelation cannot be used as well for various reasons. I'd like to thank you for giving me a patient hearing. Those are my coordinates. Any of you want to go into details of it, we run courses. We do it online, and you can just check up any of my websites over there. Over to you, Renuka. Thank you for having me here. If you have time for questions, I'm willing to take them. Apologies for the stream getting cut. We had an outage. Despite all my efforts, I could not prevent that. Thank you so much, Renuka.
No problem. Thank you so much, sir. It was a wonderful session. It's such a complex topic, the heavy metal, but the way you simply explained it was just wonderful. We have a lot of patients here in the audience as well as practitioners, and it was equally very valuable information that you've shared. Thank you so much.